Contralateral hip rotation stretch, bicep femoris focused. This stretch therapy modality is very similar to which other stretch therapy modality, Matt?
Supine internally rotated hip flexion stretch.
Very similar to the supine internally rotated hip flexion stretch. Now, both of these kind of stem from supine max hip flexion, right? Which is working on increasing hip flexion range of motion with the extended knee. If you may remember, and I want you to know the variations here, because in first learning, people be like, well, what is the difference? The supine internally rotated hip flexion stretch is the one that comes across slightly kind of into this stretch position. It's mostly still focused on that hip flexion, that basic foundational hip flexion stretch, with a little adduction and some internal rotation. Now, this contralateral hip rotation stretch, bicep femoris focus, has the same setup. Even more important is that the pelvis has to be neutral or even slightly shifted in the contralateral direction of the direction we're going to go. So, we're going to go this direction, stretching the right side leg. So we want to bring the pelvis slightly, not a lot, but slightly into the left position, and it will make a lot of sense in just a moment. We'll come up just starting to feel a little slight end range of motion feel. Then we're going to come across and grasp the pelvis on that same side, on the ipsilateral side as that we're stretching the bicep femoris here. And that's really the bicep femoris focus, is the contralateral hip rotation, which is where we come across a lot, which is another exercise similar here where you really focus on abduction, but the bicep femoris focus, we come across, and as soon as we start to feel in range of that abduction, we don't focus on finding our 6 or our intensity of stretch going into abduction or rotation. We find it in going into hip flexion. So we're going to keep the dorsiflexion here, and we're going to go into end range hip flexion. And as you can see, the setup with that pelvis, even though we did that setup, we're already starting to get a little bit of twisting of the pelvis coming up into that ipsilateral side as we're stretching. So the pelvis and lumbar spine is starting to rotate a little, which is okay, a little, right? But that's why we overdo that hip pelvis position coming in this way to start with, so that when we go into the stretch, we actually have the pelvis where we want to be. And of course, we're going to apply the stretch to the proper intensity. Ask the client what the intensity is. You can apply different methods: contract, relax, crack method. You can do manual therapy through here. You can do use the percussion gun through the bicep femoris. But that is the contralateral hip rotation stretch with bicep femoris focus.